Good morning, everybody. This is Dr. Omar from Signature Smiles. This is
Good morning.
our lovely Therese. She's the best
Therese.
hygienist ever and patient advocate as well. How are you, Therese?
Yes, I'm doing very well.
Doing very well. Awesome. We're starting a quick talk about all what you need about dental implants. I
Right.
mean, most of our patients, they don't know what dental implants. Everybody doesn't kind of understand what's
Right.
happening with dental implants.
I think it's an overwhelming, can be a daunting topic, and you know, we kind of fear the unknown in life with everything, you
Okay.
know. And I think it's something that it's a hard concept, or somebody will automatically just think that that's not for me. I'm not going to be able to do it, and they shut themselves down before even exploring it as an option.
Yeah, especially that.
I feel it needs to be more normalized,
Yeah.
and just the first option instead of the last option. You know?
I agree. There's not a lot of dentists or talk about it,
No,
right?
even in medical field, physicians, doctors, I think just the public in general needs to be more educated on that it's a first line of treatment. It's not like a luxury anymore.
I'll tell you my experience actually first, so you can actually comment on that. I graduated. Did my first bridge where I actually had to go to 2 virgin teeth, cut them down. I still remember that patient.
Yeah.
He couldn't afford dental implants, wanted, because insurance covered bridges more.
Right.
And he came 1 week later, and he needed nerve treatment in both teeth.
I believe it.
That was very traumatizing to
Okay.
me. We did root canals for the 2 teeth, and that's back in, almost 15 years ago or something like that. And at that, I made a decision that week that I'm not doing bridges anymore.
Yeah.
And because if he was my brother, I would not do it. I'd just
Right.
do a dental implant.
Right.
When did you start talking about that or seeing the difference of implants? Do you remember something like that?
I do. Been a practicing hygienist for about 13 years now, and I have to say, we did a lot of bridges in our first practice. Did some single implants here or there. It was more of the dentist kind of trying to get into that and
Okay.
practice with it in a way, but it wasn't something that everyone was doing. Our first line there was always a bridge, simple bridge. We submitted to insurance. And what I noticed, especially with high-risk patients, high-risk meaning, they have a lot of habits that can cause cavities. The bridge is just an unpredictable option, in my opinion. I can guarantee an implant for a lot longer.
Yeah.
A bridge, it's going to depend on your habits. How well are you cleaning it? You can't really floss around it. You got to go underneath it. So it is just definitely harder to maintain. And I got to a point to where I'm like, it's just not worth it.
Yeah.
And it's not worth, especially like you said, like I won't even consider it. If there's 2 healthy teeth that are doing great, why do I want to weaken those just to compromise to put a bridge?
So if we say today we're going to be talking about implant 101, where we're just targeting the single implants, what do you tell your patients about what is dental implants?
I say it's the closest thing you can get to what God gave you, is really what I say. I mean, it's truly what I believe. The structure of a tooth with the root and the crown to do the eating, and the root to support that crown. That's exactly how an implant's going to work.
So just to show what Therese was mentioned, if we look at the teeth over here, this is healthy gums over here. We have 3 teeth. And if we go around, that's exactly what dental implants are. Basically, it's a titanium post that you get it from Home Depot, or where we get it.
Yeah, I think it's Lowe's, depending on.
It's cheaper,
it
right?
depends on the special.
Yeah,
Yeah,
so-
so they switch back between Home
So it's
Depot
a
and Lowe's.
titanium post that goes actually and resembles the root of the tooth. And then it holds a crown on the top of it. So that's exactly what dental implants are. So once we lose a tooth, that's what dental implants are. So if we would say for dental implants, what is other alternatives? So just talking about alternatives, what do you think? Like what other options we have for dental implants? You mentioned a bridge earlier. So can you tell us what a bridge is?
A bridge, yes. Think of it as like a bridge from one island to another. You have 2 pretty stable islands, and you got a body of water, and you need to connect that. And it needs to be structurally engineered and stable in a way to take all the forces and all the cars that are driving over the bridge. So it's pretty much what we do here. If you have a tooth that's missing, okay, we had to take a tooth out, and an implant is not an option, or we feel in your case, you know what, your home care is great, your low cavity risk. For you, a bridge can be an option. I think we can make that work. So a bridge would be to prep these 2 teeth down.
So what she means with prep is basically cutting them down like this, So coming to these two poor, they are sitting, enjoying their life, and they would say, you know what, we're just gonna give you extra work. And we asked them to hold the pressure of a third tooth over here, that's how a bridge looks like.
Yeah, so these are like here's the bridge, and then you have your roadways that lead to the bridge, and you have to build that up and connect everything together.
So basically, that's what the bridge is. Now, it is a good option for the last 50, 60 years when we did not have the advances, because one of the options is to do nothing too, and we'll come back to that. But that's what dentists did for the last 60 years, and that's what insurance covered for the last 60 years. And it worked. It did save a lot of headache issues. It restored function. You can eat with them. That's nice about bridges, that you can eat with them. They are actually fixed. You don't take them out, you don't put them back in. And not just that, insurance covers them, so they're more affordable in the short term. They look nice.
They look nice.
We can, and they're better for the dentist because we do them in 2 visits, so it's quick. And it's basically, if I would say, it is easier, faster for the dentist to do it as well. And that's why most dentists tend to go that route over there. But what is the bad things about it?
Yeah, I mean, that's what I'm thinking when you're going over the good things. I feel like the bad things can outweigh.
But how long a bridge averagely lasts, you think?
With excellent home care, I mean, 7 years, 10 years.
I mean, let's be
optimistic. 10 years or more.
10? I would say 10 is a good number.
But most of my patients they're on a lot of medications that cause dry mouth. A lot of medically compromised patients that just don't have the saliva they used to. One part of the bridge goes bad, you lose the whole bridge. Dr. Omar mentioned before, if you have 2 healthy teeth, you're already compromising 2 healthy teeth. They're hard to, I'm still going with the disadvantages. They're hard to clean under, so you have to clean underneath it. And also you're not retaining the bone here. So anytime the bone loses a tooth, the bone says, hey, I'm not needed anymore. There's nothing here for me to do. And it starts to shrink away. And that can actually affect the bone on those adjacent teeth. It can lead to more bone loss. So there's a lot of things to think about, and you have to look at the patient behind the mouth. And it's going to depend on the patient, because in some cases it can work great.
You reminded me of my wife. So my wife, she was born with 2 missing teeth.
Oh yeah.
The bicuspids, and she wanted bridges because she hated the idea of putting a screw, in her mouth. She hated it. She didn't like it. And what I told her, I said, listen, this was our first month getting married. I was like, listen, I'm planning to keep you longer than 10 years.
He's like, I know.
And I want to do a treatment that lasts you for the rest of your life. And a bridge, I know I'm going to dealing with it in 10 years. And the issue with that is, yes, it lasts 10 years. Yes, it's way more affordable in the first 7 to 10 years. But what happened is, you start getting cavities in these 2, and may end up needing root canal, and actually may end up losing one of them. Most of the people we see, they wait too long, and then now you're gonna lose, 2 teeth, for example. Then it's getting more expensive to fix the problem, because instead of needing just 1 implant to replace the space, now we need 2 or 3 actually. So if you are 85 or 80 years old, I mean, maybe we consider a bridge, because we know, we have 10 years, let's go. But if you're 60, even, or 30 or 60, and you're planning to go, I mean, the average living woman and men in America is now 85 plus, 80, something like that. Actually, woman lives longer.
But that's a great thing to consider too, is although they're living longer, they have dry mouth, their saliva's not working anymore. They're living longer, but they're compromised. And the other thing too, what you were saying, if you ever do want implants, by having a bridge and having this area, collapse over time, it's just going to be more expensive later on then to build that area back up to then get an implant.
So my other question, some patients say, before putting the implant over here, so that's what bridges are, right? Did we need to talk anything else about bridges?
No.
Okay. So
they can work, but it depends.
Implants, we'll come back to them. But what other options we have here? So we have 4 options to replace the missing tooth. We started talking about do nothing. So let's talk about that. And that's, unfortunately, most people does the do nothing. Especially it's a back tooth. Let's say it's a back tooth. Nobody sees that back tooth, and everybody says, who cares about fixing something? I don't want to spend, much money. I don't want to do it. It doesn't hurt. I can't chew. What do you think about that? So that's an option.
I think that, again, it's it's hard for a person to see that far into the future. So right now, their thought is, I don't have a lot of money. I have a lot of other issues I need to take care of. My main goal is getting out of pain because this tooth has been bothering me. And that's about as much as they can take at that time. Can you work towards a more long-term goal and get them to value that idea? Yes, but I think in the beginning, there's so much going on and there's a lot of information coming in at you. And I think that it's a hard concept to understand. Like, it's a back tooth, who cares? But they're not realizing the bone loss over time.
But the issues, let's talk about the issues. So the first issue I see is, if we leave that back tooth missing.
That's what I'm getting into.
Yeah.
That's what they can't see that though, what's going to happen if you leave it. So
because it doesn't hurt.
It's hard. I can't see into the future. It's hard. I just started. I'm 30.
Don't say your age on here.
I'm about to be.
You're 29. Okay,
I'm 29 years old.
Right.
But I'm just now getting into my 401k that, Lovely Signature Smiles offers and helps with that. And I'm just now taking advantage of that. And to me, looking back, that's so silly. But I had a hard time seeing into the future and being like, that's something I have to prepare for. And it's a hard concept to understand, because in that moment, you want to be out of pain. You want to get out of that office as soon as you can. And you're like, I will deal with this later. No one's going to see it. It's fine.
Yes.
And I think it's raising that awareness of the consequences of these things long term.
And that's the point when I see people who's coming, just for a cleaning. Even we took the tooth out and they was like, it's a back tooth. So let's talk about what is the problem with that concept, that do nothing. So there is no good in that, period. I mean, if there was no good to have a tooth, God would not even started creating that tooth. Right. Number one is, each tooth in our mouth had a responsibility. There is teeth that cut, teeth that chew. Every tooth had a responsibility and function. And the second you lose a tooth, there is somebody else had to do the job. I mean, you're still not gonna stop eating, so there is somebody else had to do the job.
Exactly.
So what happened is, yes, you lost a tooth here, but there is other teeth in the area, especially on the other side actually, and our brain tricks us. We think that we can chew. It's actually, you start chewing way more on the other side, which basically overloading the other side.
Correct.
Then what happened next? In few years,
cracks, breaks.
You have a crack, break, you lose another tooth. So studies has shown that if you lose a tooth, there is a very high chance there is, in the coming 5 years, you lose a second tooth.
We see the same ones on each side a lot, right?
Because you really overloaded somebody else. And now you get into the cycle of, now you have missing two teeth. It's like, who cares? Then you get to a third cycle. Then you get stuck in a sinkhole. And then you come at age 50, 55, say, Doc, you know what? I hate this. I can't chew. It doesn't look nice. Now start moving forward. Now you're using your front teeth toward everything, cutting, chewing, smiling, all of that, plus grinding. So now we start having issues toward, smiling. I can't chew my food. I had to cut it into small pieces. So the do nothing, now we have to spend $30,000 trying to recover from that, right? That's kind of the story. And so that's the do nothing.
And it's more time of just not having that quality of life in the present. I mean, you want to start living. You want to have a better quality of life. And
let's keep this for a second here. But what is the second problem is, let's say that person did not lose any other teeth. He just have one tooth. What usually happens? Teeth start shifting. So what we mean with teeth start shifting is these two teeth, our teeth, everybody think that our teeth are stable, fixated. They are not. They are moving. The only reason why they stopped, because they actually moved when we were kids. They moved like this, and what happened? They hit
each other.
Exactly. And the second they hit, they stopped. And the side teeth, they do the same thing. They stop each other, so they all align. They are in continuous movement, actually. They're like, there is a cushion movement in them, always. And this is one of the best designs, in teeth. Now, what happened in this, these two teeth will start moving toward each other. Not just that, the top tooth actually will be like, what is my partner? Start actually moving down. It reactivates and start moving down because there's nothing now to stop it. And you leave this for 5, 7, 8 years. Now we have teeth sideways. We have a top tooth going down. We see that
all the time.
All the time.
Every day.
And I'll be honest with you, there is really not much fix. Either you're gonna go through braces and spend $10,000 in braces trying to align everybody, and nobody wanna do that at age 50. But it all happened because one tooth was taken out back in when you're 20, right?
And that's the really hard to get a patient to see that far ahead.
Yes.
Right? Because they're there day one. We're talking about what happens 5 years later. So I think that's the challenge, and I think that's what we just have to keep talking about.
Yeah.
Is long-term consequences, because that can really make or break your
Yeah.
chances of getting a plan, you know, and getting something that is reasonable. It's going to be so much more difficult the longer you wait.
So that's the do nothing plan.
Yeah.
You will probably lose another tooth. Teeth is shifting. Fixing
Mm-hmm.
down the road is very expensive. And how are we gonna get? That's why we're making this video. Is
Right.
if we can get people to understand the value of these teeth,
Mm-hmm.
you know, and fixing it immediately. Yes, it is a little bit more expensive up front. It's a bigger investment up front, but long term, you're saving yourself a lot of issues.
Right.
Now, the other option is to have something removable, right? We talked about 4 options.
Yeah.
Is do nothing,
Mm-hmm.
which I think is the most expensive one, because do nothing, you will end up actually spending way more money.
Way more.
Plus, you lose your bone, and you need an implant, for example, after 10 years.
Right.
You need bone grafting. So, do nothing is the most expensive option. I talk to your dentist, make sure that you and them on the same page on that. The second one is, we said, a dental implant. So basically, dental implant, you go in and you just put an implant right there and be done, right? Third option is doing a bridge, where we cut virgin teeth, and we talked about that. And the last thing is to have something removable in and out.
A little partial or flipper.
It helps with just keeping the teeth not
Shifting.
moving, but it's better than nothing.
Right.
But chewing wise, nothing.
Yeah, it's a very compromised treatment option, especially for our younger patients. You know, they don't want to take anything out at night.
Yeah.
That's going on your nightstand. So I know personally, and I know every woman in my family would not be okay with that. I was actually just asking George this morning, because George is my husband, but I was coming in to do the podcast, and I was just talking to him, and I go, because he got that implant for this molar right here in the front. We were joking around for a while, calling him Jambalaya George, because he was missing his tooth, and he was rocking with it for a while. He was good with it. But I asked him, I said, what has this done for you? And he's like, oh my gosh, he's like, I can smile, because he used to smile like this for years until we put that
You're very aware of it.
Put that implant in. It's right here behind his canine. And I was asking him this morning, and he's like, it's great. He's like, I can chew. And the first thing he said, though, he goes, feels like a tooth. That's what his response was. Feels like my tooth. That's what he said.
I love that. My wife, so we ended up putting 2 implants for her. She asked me every few months, which are my implants? And this is what, 15 years in marriage? Exactly. It's like, which tooth? So they do look. I mean, if I ask you which one is this, you can't tell, which is nice about implants.
It is really nice. And they don't get cavities. That's a great thing.
They don't get cavities. How long they last? What do you think?
I mean,
if done right.
I mean, it's
maintained
25 plus years, 30 years.
So if done right, maintained right.
Yeah, come in for your
They should outlive the teeth.
They really should. I mean, they do. We see that. I have patients all the time that come in, and it is sad to see, because some people invest a lot of money over the years, and you get, it's just wasted investments over and over, and that's that sinkhole Dr. Omar was talking about. But they get to the point, they come in their 70s, and I'm like, man, we got some really good implants in here that look good still, and most of them are either gone or on their way out, and it's like, we can't use those implants that are in there most of the time. So again, it's raising that awareness.
If done right and maintained right, and that's the trick of the dental implants, you want to get it done from first shot. The success rate goes from, because it is actually the success rate of dental implants, whether it's one implant or full mouth implants, you're talking about 96%. This is the highest for long term, the highest success rate we have in dentistry. There is nothing else match that. Not a root canal, nothing else match that. But if it fails first time, I had a patient yesterday, he actually had 2 implants somewhere else, and they were placed completely out of the bone, and we had now to take them out, put the implants. That's number 1, 2 more expensive. And number 2 is the success rate go from 96 to actually 67%. So if done right, maintained well, they should last for the rest of your life.
And done right. And I always encourage my patients, I have a lot of implant consults with my patients, and I'm just upfront and honest, just like if you're going to get a car, or you're going on a date, you're not going to marry the first person you go on a date on, right? You're meeting them for the first time. You're coming in, you're meeting me for the first time. We're throwing all this information at you. Please go for consults, do your research, be your own advocate, go get second opinions. I guarantee you'll be able to feel a difference in the communication and care from the providers, and then you'll know the best decision to make. Cost aside, I do encourage to go and get the consults, because I will say, I mean, that there is a difference in it being done right, and also it is a journey. So you want a caring team to be there by your side, because there's some ups and downs with it,
So, speaking about that, let's talk about how long does it take to do one implant.
One implant.
We're focusing today on
Right.
one implant. Like doing a back tooth or front tooth, how long does it take from A to Z? Healing time, because you said a journey and that's what it clicked. It's not like a one and done.
No.
A bridge is easier, faster for everybody, but the implant takes time, just like a relationship.
Just like
you
weight loss.
take time to nurture it. It's like weight loss.
Because that's why you lose it too quick and it comes back right away.
So you're nurturing the relation, but once done, you're good for a long time.
Yes.
So it takes what for a back tooth?
Simple, straightforward implant.
Yeah.
6 months.
6 months.
6 months, I would say. Straightforward, no complications.
Now, what about the tooth in the front? They say like you can get the tooth in one day. What do you think about that?
Well, you don't put as much forces on your front teeth. So I will say, in some cases, we can load it in the front. We don't want you to go without a front tooth.
So loaded means that we can actually take the tooth out. So the same day we're taking the tooth out, the implant on the same day, and actually put a tooth on the top of it on the same day. It is not the final tooth you get temporary, so you're not going around with no teeth. It's great. It function when it's not for everybody. But when we decide that this is the best long term, we can do that, and it's nice because you go no time with no teeth. That's what's really we plan is. When we plan something, we plan not to have missing teeth anytime.
That's the goal.
So
Nobody wants to
tooth in one day works.
It does.
When done right. But here's the trick. If we feel
compliance from the patient is a big thing.
Yeah, we'll talk about that in a bit. That's important. But here's the thing. If we felt at one point that this could compromise the long term, we will not do it Sunday. No. I had a 20 years old. She's a swimmer.
Yeah, I have seen
and she was getting out of the swimming pool, and she hit her front tooth, lost it, complete damage the gums, bone. Could we have done tooth in one day? We could, but it may not guarantee how it looked like. So she actually took 9 months.
Yeah.
But built it up super nice. She shows everything. She's done. Yeah. So
there's a lot of intricate details, your little gums that show in between the teeth, like that. A lot of that comes into planning.
So more important is you can do it fast, you can do it long, but the question is, which is customized for your quality of the bone.
Yeah.
Quality of your gums, all of that infection. And more important is what is the long-term gain from that? Because I don't want to cut corners just to get you there.
Exactly.
And if you're scared, we put you to sleep. Don't worry about that.
That's always just it.
Yes,
that's pretty much included.
Yeah. You sleep through the dental implants.
You don't really have too much of a choice. I have a lot of people lately. They're not even scared, but they're like, you know what? I don't want to lay here for 3 hours. Just sedate me.
Just sedate me.
I got 5 kids at home. Let me take a breather. let me just relax.
I love that. So. But people still say, why does insurance cover? Does insurance cover single implants? We thought, does it cover it or does not cover it? Why they don't cover it? This is the touchy topic. You always get touchy.
I'm heated up already. You just mentioned insurance and implants and.
So why?
Because that's what I would love to see, a move made with that. But in the reality is that's not where we're at right now with insurance companies. And maybe one day, and hopeful, and again awareness. But I think you kind of have to put that aside. I wouldn't expect too much help from insurance, to be honest with you. So they're going to help with more basic dentistry, partials, but...
So let's talk about dental insurance. So dental insurance, when it came in 1971. And it came in with benefits of $1,500 in 1971.
Oh, that's pretty good.
Now, what is that? 50 years later, 2024. So if we just match their benefits still $1,500.
Or $1,000 on some of them.
Or $1,000 actually. They're going down. They don't go up. Some people have $2,000, but very, very low.
You're lucky, yeah.
So $1,500 with inflation actually. There was a study done. Insurance dental insurance should have been actually because in 1970, $1,500 you do all of your teeth.
Yeah.
In $1,500.
That's a lot.
With inflation, it should be covering now up to $8,000 to $10,000 if we just go through normal inflation. I mean, that's the deal over there. But so unfortunately, with dental insurance these days, it's not like medical insurance. And the problem, they kept the name, so they did not go with inflation. They kept the name insurance, but it's almost like a discount plan. Like you get a coupon. So most dental insurances works as coupons. They are good at cavities, as basic 101 dentistry. But when it comes to implants, number one, they don't recognize it as the best option. Their best option is a bridge for some reason. I had no idea why. So you actually get more incentive to do a bridge with dental insurance rather than doing an implant.
Yeah.
So, but they may cover some. So let's say a patient, let's talk about average cost. Average cost of one implant is, let's say it's straightforward implant, what, $4,000
to $5,000.
$4,000?
Yeah.
This is the average, and that should be what you're looking for, I think.
Right.
Now, insurance may cut $500, $1,000.
Or help with the crown that
Or
goes on
help-
top
which is,
of it,
yeah. So the 4,000 is from A to Z almost. That's the average. It can go up, it can go a little bit less with insurance, but that's kind of the plan. And if you're really shopping for dental implants, I hate the word shopping, but people does that. You want to stick around that number. If you go to a place where it's $1,000, I could tell you one thing: we fix a lot of these, and they end up costing $10,000. So, I mean, the investment itself, the price should tell you. They always say, Wendy. If you remember Wendy, she always said there is a $5 pizza, but you have to eat it.
Yeah.
So that's kind of the story there. So that's my recommendation is to be careful. If insurance pays, some insurances actually does pay a little bit toward it. So instead of $4,000 from A to Z, it may bring it down to $2,500 or $3,000. But as we say, the bridge is $1,000. So that's where people look. I was like, oh my God, I'm gonna do an implant, it's $3,500. A bridge is $1,000.
It's even more than that.
Yeah.
3 crowns. I mean,
let's
nowadays,
assume
but just
1,000
to
even,
say, yeah.
because insurance pays more. So what happened is there is 2,000. That's a big difference,
It
$2,000, unfortunately. And now what happened? You go a bridge, but first 7 years you definitely saved money.
Yeah.
7 years plus, you definitely did a major
Right.
mistake because you come back, bridge fails now. Now you need 2 implants. Now you need more work or need more advanced work, root canals and all of that. You start now having into the cycle of spending money trying to recover from the first difference. That's interesting, right?
It is interesting.
Maybe insurance will cover it. And the problem is, what's the problem? Most people call their insurance and say, do you cover implants? What do they say? They say yes.
Yeah, because if you look on there, it does say.
It does say we cover some. I mean, so our insurance usually experts, they do complimentary check, they try to apply it. But if you're thinking that insurance will cover 100%, which would be nice and sweet, we're not there yet.
They're still viewing it as a luxury for patients, unfortunately, and it's not. It's, in my opinion, a medical necessity. And again, I hope with the more and more it's shared, and other healthcare providers, I think, should really be getting more involved with sharing this information and having educational seminars at their hospitals and doctors' offices. I mean, this is something that everyone should be aware of. This isn't just a luxury. This is your quality of life. This is your nutrition. This is your overall well-being. I can't say enough about implants, really. I mean, I totally advocate for them. So it was my family. I mean, my own husband, my dad. I mean, everybody's getting implants.
My mom too. My wife, my sister.
I mean, it's just. It's a beautiful thing that we have now, and what a blessing that we're able to do that for people. But there's a lot, and what we talk next time too, but there's a lot of barriers that come along with that, and patients trying to cross those barriers, and it's doable.
I mean, the major barrier, to be honest, there's two major barriers. Barrier number one is being scared.
Right.
People are terrified. If dentists, generally speaking, now you're putting a screw in, you're drilling it, and they watch it on YouTube, and that just add to the fear.
My patient the other day just said, I don't want anything artificial. That's why she didn't want implants.
Yeah.
It wasn't anything else. It was just the thought of having something artificial.
Yeah. So, by the way, they are interesting. You said that they are the same material of which we do the hip replacement, titanium. If somebody had a car accident, they got all these titanium plates. It's actually were invented. Dental implants were invented That's fun fact, by an orthopedic, not a dentist. Back in the 70s, he was trying orthopedics, titanium, and then he was like, maybe it works on teeth. He did bring a patient, his cousin. He drilled, put an implant for him, and it worked. He actually became the #1 implant doctor in the in the world. His company still till today. So it's interesting.
Amazing.
It's the same titanium. It's very body friendly. What you
The
call
bone
it?
loves it.
The bone
Locks
loves
it right in place, just like with the joints.
And that's a good point we didn't talk about. Is when we place dental implants, the tooth actually moves, which is nice. That's the only difference design between the tooth and the implant. While the tooth moves, this is a plus. That's why our work doesn't get to God's work. But still, the nice thing about implants, it's solid.
Right.
And that fuses to the bone. If you say, hey, which tooth, if I'm gonna take a tooth out, it is easier to take a tooth out rather than an implant. Now, if it's in the bone, it's very hard. You have to cut the bone, remove it, extract, damage all the things
that's how
around it.
fused it gets.
That's how fused it gets.
The teeth are I always picture them sitting in like a little trampoline.
Yeah,
it's kind of what they
it
say.
is.
They have a little
That's a good
trampoline
way.
they sit in. They can move a little bit this way because when you eat, you need them to move a little bit. But implants, like you said, you want them solid. You want them done right. You want them integrated. You want to take your time with them. You don't want to put a crown on right away. If you can't, you want to take your time, do it right, do it once, and be set. You don't want to keep coming in every few years.
Good. So I like that. Now let's talk about, because some people now think, as you said, or some dentists are selling, if you get the implant done once and you're done, you don't need to see a dentist again. But before jumping to that, we talked about two barriers. Being scared, right? So how we solve being scared of the dentist?
I think first and foremost is making the procedure sound not so scary, because it's not. It is very state of the art, well done, seamless, planned to the T, like you have a blueprint for a house. So it's very, as far as that goes, like we got you on that. That is taken care of. You can't have it planned any better. So I think the patient needs to be educated though, because it's just a scary thought to begin with. Also, as far as the procedure itself goes, you're out. We have lovely Wendy who does our anesthesia.
All of
She's
our
a
doctors
nurse,
sedation.
and our doctors do it too. And now that we have her, we can do even more. We're doing IV every day. IV sedation is wonderful. It's safe. It's conscious sedation, and we want you relaxed.
It's like you've never been there.
It's like you've never been there. You don't remember anything. My husband's had it done.
So sedation is actually the way to go.
Sedation is just the way to go, and they've done studies. You will heal quicker because your brain does not have any concept of any trauma that happened. So you actually heal.
I know that.
That is very true. You heal faster when you have a memory of the procedure and the actual implant getting placed and the noises and the little bit of trauma and stress that comes with that. It can affect your healing.
So if you're scared, it's basically, I always tell my patient, one of us should be sleeping. It's either me or you.
Always.
And because if you're scared and terrified and you're going to be like too much, it's just affect the dentist placing the implant themselves. So that's the first barrier. The second barrier is finance, money. It is a big barrier, to be honest. That's why we try to get insurance, payment plans, third-party finance. Some people pay, in cash, but there's always an option. There's always, you had to find a dentist who can work with you on these options and take it from there. Now going back to, you said something interesting is, in the old day, we used to put implants, just like you're drilling a screw and done. And I've done that for a long time too, but in the last probably 10 years, we started, talking about what we call guided implants, where, where we talk about huge difference. So in the old days, we used to do x-rays, 2D. So we don't know much about bone. We plan it as much as we can. And that's how everything starts, right? And we go in, you don't know if you have bone, you put an implant, complication could happen. It still managed to work, but it's very difficult. These days, we have the advances in technology is huge. We actually take a 3D scan, which is a CT scan. We can know everything. The amount of bone before we even jump in. The quality of the bone. Is it thick bone? Is it drywall or it's concrete? And what kind of, and then we plan, we do digital scans. We don't do impressions, all of the, the material, the rubber material, we don't use it. We just do it like a camera scan. And the nice thing is you merge everything together. And now you have full information, and then you actually build a guide where you know exactly where the implant's gonna go before even the surgery. And that makes sure that we perfect the placement of the implant where the tooth should be, because in the old days, even sometimes you see implants, it's like, it's an implant in there, but I cannot put a tooth on the top of it. So
I got a story
that
about
made
that
things, really? What
My
story?
last dentist. We didn't have a CT scan.
In the last dentist office?
Yeah,
Not
that
Signature
I worked.
Smiles. Oh,
No.
okay.
I'll be at Signature Smiles for the rest of my life. But the last one I was at before I found my home. What'd you say?
I'm not sure about
Oh,
if I'm
you're
going
not
to
sure?
say.
So this poor man, he X-ray, implant, upper. We know the bone on the upper is not the most fun to work with, especially in the sinus area. No CT used.
Yeah.
Guy came back and implant swimming around in his sinus cavity.
Oh, wow. In the sinus.
In the sinus.
I seen that actually once too.
And it's because
You have to sneeze. It comes out.
Yeah, right. Like just.
Yeah.
It's
scary.
We hear it, and that probably sounds shocking to whoever's watching this.
Yeah.
Like, oh my gosh, I don't want that to happen. But that's what we're saying is that, the extra time, the extra cost, all the extra care, the team of specialists that get together to plan these cases, you want all that. You want all that done. You, just like you're building your own home that your kids are going to grow up in. You're not going to want to cut corners and have,
you want to have blueprints. Exactly
leaky
how
windows
it looks like.
that it's cold and you're spending more money on heat in the winter. You just really, you want it done once the right way and you're set. And then you want a team though too that's going to carry on with you through the rest of your life and be there by your side to help you.
One of the issues I'm seeing more and more often is we see complications. So dentists do implants in complications and that they don't know how to treat. So one of the tricks is one of the things, for example, you had to ask is there like kind of warranty on it? They could fail, and if implant fails, we say the success rate is 95%, 96%. So there's 5% chance you could fail, even if
early on.
Yeah, even if the the best surgeon done it, right? You still have 5%. The question is who's going to take responsibility. Right. Like for example, we do like 5-year warranty. Anything happened to the implant, as far as you did the right maintenance, we'll talk about in a second. We do it. We fix it for you if you didn't, if you follow the instructions and all of that.
The beautiful thing.
That's important, to be honest.
Well, in 5 years.
To be able to handle complications.
But some people say 5 years. That's not very long if you're telling me it's 30-year
plan.
No,
if they survive 5 years,
explain this. If an issue with an implant is going to arise, it's usually going to happen within the first year and a half.
Yeah.
You get past a couple years, things are looking great, you're coming in for your cleanings, you're smooth sailing from there. So, and that's the beautiful thing. So, you're 5 years in, you're good. There's unless something crazy
it takes
and you fall.
18 months to average 18 months to start seeing issues. That's where you want to save yourself.
And that's why we're there in the beginning, the most crucial time that first year, to catch any issues very early on. So we are there with you.
So don't place an implant and move to another city.
Don't just go
that could be dangerous.
Don't just go to a surgery center and then just try to find a new dentist. Be somewhere that's also going to be your team and stay with you. That's important. You want that trust.
So let's talk about maintenance, because implants are there to stay. You place them, they stay, we said 25 years. If done right, maintained right. A lot of, unfortunately, myths or that the dentists themselves say it, and they don't catch themselves. You don't need to do anything. Right. They don't get cavities, you're fine. Right. So they fail. Implants fail because of what, main thing is the bite forces. If the bite is not really good. Number two, if gum disease.
Home care.
So what's your recommendation for home care for dental implants and like professional care? You placed implant. Let's say somebody came and said, I have 2 implants in my mouth or full implants. What is the protocol so you can keep these teeth for the rest of your life?
Well, you want to take care of your tooth just like any other tooth, the implant. You want to thoroughly floss around it.
Okay.
Water picks are great. Sometimes with implants, I always think of it as like a upside down mushroom. Yeah. And you can have kind of more of a rounder area to have to clean around. So a lot of times we recommend water picks.
We'll make a video how to clean, actually. That'll be nice.
Yeah. Brushes, soft brushes that go in between the teeth. There's great antimicrobial rinses.
Is that every day, every week, once a month?
This is every day.
Daily.
This is every, you spend money on your BMW. I'm pretty sure people are taking them for their oil changes.
Yeah.
You're not taking it once a year. This is something you spent time on, you were nervous about, you took a long time to decide to get, and it's in there now and it's working great. That's got to be motivation enough to keep it clean.
So you're thinking daily, they had to brush and floss.
Brushing.
This is the common
Daily.
wisdom, right?
If you're a clencher grinder, you got a lot of forces on your teeth. You know,
Yeah,
our
that's
jaws
important.
at night produce 900 newtons of force, which is 3 times the amount than the day, which is insane. That's 200 pounds per square inch.
That's a lot.
That's wild.
That's right.
So your implant there is as strong as it is, still not, you know, as great
Yeah.
as what God gave us, but you got to protect that. So if that's something your doctor recommends and you need to wear a little something at night to add some protection, absorb those forces, I highly recommend you do it, because that's
you know,
another
you mentioned that's important.
compromise.
Because implants will take forces like this, but they will not take any
They don't have the
movements.
trampoline.
They don't have the
underneath them.
trampoline effect. That's
They
one of the
can't-
disadvantages of implants. Not disadvantages, but one of the tricks that you need to be careful. So if you're a clencher if you're a clencher, it's okay because you go like this.
Exactly.
Implants
Your
will
tooth
take
goes
it.
with it.
Yeah. Now if you're a grinder, it goes sideways. That's the worst for dental implants. So a mouthpiece, a deprogrammer, you have to.
You have to.
So that's good. So daily is brush, floss, and mouthpiece.
Yeah.
What about do they need to come to see a hygienist?
Yeah, the first year, honestly, and depending on if you already, a lot of people get implants because they've had periodontal issues, gum disease issues. Even the first year, we want to see you every 3 months a lot of times. I mean, we want to keep up on it, make sure you're doing what you need to do. If something's not working, let's not keep trying to get you to do the same thing. Like we've told you for 2 years to floss. It's not working. Let's find something that's going to work for you. We don't like to just have things generalized.
So the first year is 3 months, and then after that 6 months, just like regular teeth.
Exactly.
Okay.
And we're going to look at you as the patient, what works for you.
Yeah.
It's not straight across like everyone's.
But
floss
generally,
brush.
that's a general
But
idea.
generally, yes. Brush twice a day. Keep it clean. Keep the food out of it.
Yeah.
Protect the forces against it.
And
And
the
smile
nice
with
thing
it.
about that as a dentist, if I see something wrong, I can stop it at this stage. And that's why it's
Exactly.
very crucial in the first 2
Yes.
years actually, to be close friends with your dentist
Right.
and hygienist once you have an implant. Because if it's past 2 years and things are stabilized, we're good.
Smooth, yeah.
You know, it's almost we're good, but still need to see every 6 months.
Exactly.
Just normal checkup. But the first 2 years, if you go and disappear and come back after,
Yeah.
it happened a lot through COVID.
Yeah.
When COVID hit, we have patients that they disappear for 3-4 years.
Right.
Not 4 years. We're only 4 years, but
Well,
in
no,
almost
I
3
mean,
years.
No, you're right.
And that,
4
although we
years.
tried to see them, but some people were scared. We understand that, but that did
That
cause
was
some
tough.
issues with the implants we had to recover from. But this is maintenance is a key to keep the teeth
Right.
for lifelong.
Right.
Sounds good.
It sounds good. And
All
this
right.
is, yes, what was open
was,
conversation. We're here. And please, post questions in the comments.
Yeah.
That would be awesome, because we want to hear from you and help this sound not so daunting. And everybody can do it. And,
Yeah.
you should feel empowered to do that for yourself. Don't just write it off and think that's not for me. I'll never be able to do it. Just explore it.
And if you have any question, just send it to us.
Mm-hmm.
We'll be able to answer it next time. There's a lot of things: smoking, diabetes,
whatever you
how we
wanna
handle
know.
that. We will be talking more and more about implants and being scared and sedation. So any question you have in your mind, even teeth, health, just send it to us. Me and Therese will
Yeah.
talk
I
about
love it.
Hopefully you enjoyed it.
Yes.
Thank
Take care.
you.
Have a
Take
great
care.
day.